Thank you for joining today's webinar entitled Scaling for Success, Ending the HIV Epidemic. My name is Kayla Coleman, and I am a marketing manager for OraSure Technologies, and I will be your moderator today. In order to cut down on background noise, we have automatically muted everyone's microphone as you enter the webinar room, but we do have the Q&A tool set up to receive questions throughout the webinar. The Q&A feature can be found at the bottom of the webinar window. We will use the second part of the webinar as a live Q&A session if we have time left within the hour. If you have questions you'd like to submit for the panelists, please put them through the Q&A feature and I will read them out to our panelists. We'll try to answer all questions during the webinar, but if we cannot get to your question, we'll follow up with you directly after today's session. We also have contact details at the end of each presentation and at the end of the webinar in case you experience any issues and are unable to submit your questions. It has been 6 months since the beginning of the COVID-19 pandemic in the US and approximately 3 months since the beginning of lockdown. While some states start to lift the stay-at-home orders and allow more businesses to open, there are talks of a second wave of lockdowns. There remains many uncertainties, but one thing that is for certain is the need to find innovative ways to test for HIV during the pandemic. Recently, on their webinar titled In the Know, National HIV Testing Day 2020, the CDC referenced that HIV testing is down by roughly 50 to 70%. Despite the challenges that we are currently faced with, the goal of ending the HIV epidemic is ever present. To that end, we continue to host our Testing Thursdays webinar to provide useful information and insight to you from your peers during this difficult time. My colleague, Kay Dendy, will be introducing our speakers today. Kay is a part of our public health team. She has a total of 22 years experience in public health. Prior to joining the team at OraSure, she was the Director of Business Development for Planned Parenthood Federation of America. Kay, thank you. And with that, I'll hand it over to you.
Thank you, Kayla. Thank you for joining us today, and thank you for your flexibility during a time of community activism, health challenges and solutions, and social change. At OraSure, we're walking with you. We have been involved with ending the HIV epidemic through developing the best diagnostic tools in the market. Though the most important work is completed by you, our partners, in ending the epidemic. Today, we present 2 examples of stellar and successful testing programs. Our first presenter will be Glen Spencer and Juan Lopez from Aunt Rita's Foundation. Aunt Rita's Foundation is a nonprofit HIV service organization in Phoenix, Arizona that has administered Arizona Home HIV Testing Initiative since 2018. They are funded by the Arizona Department of Health Services. They offer free at-home HIV tests utilizing online requests and voucher redemption codes. They are a model of success which key opinion leaders have consulted, and many have replicated their work. Welcome, Glen and Juan.
Thank you very much, Kay, and thank you, Kayla, and thanks to OraSure. This is Glen Spencer, Executive Director of Aunt Rita's Foundation. And before Juan Lopez, who's our Director of Programs, takes you through the slide presentation, I think I just want to give a little bit of background on our program. It was instituted 2 years ago in Arizona with the support and funding from Arizona Department of Health Services that chose to contract with Aunt Rita's Foundation, a private community-based organization, to administer the program. The motivations when this program was first instituted was to better reach rural individuals who did not have the same kind of opportunity for HIV testing, and to better reach individuals who may have stigma associated with going into a HIV service organization for testing. And I think as you look at some of the data that Juan is going to take you through today, you'll see that those interests are being met. of course, with COVID-19 and stay-at-home related issues, there's a lot more interest in home testing or self-testing. And of course, that's really great. But I don't want us to miss the fact that this home HIV test kit initiative is very, very relevant to individuals who may not otherwise have the opportunity for testing. In Arizona, the Department of Health and Aunt Rita's Foundation see this as part of the overall testing strategies. So it's certainly not intended to replace the more traditional testing models at locations. So we're really proud of the program. It's gone very smoothly. And with that, Juan, I will let you take us through the slide deck.
Perfect. Thank you so much, Glenn. And thank you, Kayla and Kate, for having us today. So as we advance into the next slide here, we're going to go over about how the program started, when it started, and how it kind of all came together. So in August of 2018 was when we first launched mysterykit.org. So that's where you could get your free at-home HIV test kit mailed directly to your door. You simply answer a few questions on a pre-survey, and then once we have your information, we mail it directly to you. Or if individuals prefer to pick it up in person, they can request a Walgreens card as well that can be redeemed for the test kit itself. In January of 2019, we launched the Spanish counterpart of the site, which is mipaquete.org. So same concept, worked exactly the same as mysterykit.org. It was just a Spanish site, so we could reach a wider audience and just make it easier for individuals who might not speak English fluently or don't feel comfortable navigating through an English site. We wanted to make it a lot easier for them. And then in October of 2019, that's when we launched gettestedaz.org. So gettestedaz.org is, apart from the home HIV test kits, it's also a partnership with Sonora Quest Labs and Albertson Safeway pharmacies, where individuals can redeem a free HIV test as long as they have a voucher provided by us. So we launched it in October of 2019, and we merged all the sites together in January of 2020, including a Spanish version of the site, which is on the same URL. So it makes it a little less complicated for individuals to have to navigate through multiple sites. It's simply all on one site that includes resources about PrEP and PEP. It shows you different options for how you would want to do the test itself. So you can choose the at-home kit, or you can choose to redeem a voucher in person at one of our participating locations. And by partnering up with these partners, we were actually able to increase free HIV testing in Arizona by nearly 100 locations, which is awesome. And we've had a pretty good turnout and pretty good feedback on our program itself. But still, the home HIV test kit is probably one of our most popular options, mainly for convenience. And we will touch on feedback that we get from individuals later on in the slide deck here. But as we move on to the next slide, we're going to talk a little bit more about the demographic of who is requesting these actual kits in their locations. So these numbers show from August 2018 to February 2020. This is all through Arizona, obviously. So we can provide a test to any individual living in Arizona with at least 16 years of age. As you can see, Phoenix, which is where we're based and kind of where the biggest population is located, has the most requests here. We do have requests from more rural areas, including Flagstaff, Kingman, Lake Havasu, some of the smaller towns that don't have access to testing, or they just don't have the mode of transportation to get to a testing location near them. So from August 2018 to February 2020, we distributed a total of 2,847 tests, and they're all completely free. So all these tests were given for free to individuals. They did it all at home. If they needed any help with anything, they were more than welcome to call us, but that is a pretty high number for us. And then in a couple slides in, we're going to talk about the difference and the impact that COVID had on us. So as we move on to the next slide, we can see here the breakdown as to person's background. So as you can see, Hispanic and Mexican individuals, we have a total of 1,328 tests that were requested between August and February of August 2018 and February 2020. African Americans, we are at 202. And then anybody else who identified as white or any other race, we have 1,317. Now, the Hispanic and Mexican community, we do have a lot of requests for them, and it has to do a lot with the partnerships that we have built in the community. So as you can see in the next slide here, we do partner with a couple different organizations, and we partner with different TV medias that can help us engage that community and really reach out to them, being that they are a little bit more at risk than the white community. So we partner with Univision Arizona. So twice annual phone banks we do with them. We do one around AIDS Walk, which AIDS Walk we have in February. So we do one around that time, not only to promote AIDS Walk, but also to promote the home HIV test kit. The way it works, we basically have a team of volunteers. We all sit and wait for calls from individuals. We do a couple interviews on live TV, and then individuals are free to call us to request either a test kit, or if they just have general questions about HIV or PrEP and PEP, or if they have any questions about providers or where to seek care, they can call us directly to Univision, and we're able to answer all those questions for them. We also partner with Chicanos por la Causa in their Luces program, which Luces is Latinos Unidos contra el SIDA, so Latinos United Against AIDS. And they're a great organization here in Phoenix, and they are very involved with the Hispanic community, and they do a lot of different events, and they do a lot of different outreach opportunities, and they do a lot of educational events where they help people not only get a home HIV test kit, but if they require additional assistance, they will help them. If the individual doesn't feel comfortable doing the test themselves, they will walk them through it. So they are a great community partner that we have, and they do a lot of work with the Hispanic community, which really helps us broaden our horizons and reach them a little bit closer. And again, Chicanos por la Causa, most of their employees and most of the volunteers they have are all Hispanic. So it really helps that Hispanic individuals can relate to them and they feel more comfortable coming to them to request those kits as well. So as we move on to the next slide, we're going to talk about a little bit about the breakdown between gender. So women requested 818 kits during that time frame. Males requested 1,678. Anybody else identifying as a trans individual or non-binary, we have 351 total. So as you can see, we are very popular within the male community. We do have a lot of females as well that request a test kit for themselves, or from my experience, what I've noticed is in the Hispanic community, a lot of the women request it for their kids, or they request it for someone they might know that might need that HIV test, but they're afraid to do it, which again links back to Chicanos por la Causa and Univision and the great work that they do in the community. So as we move on, we're going to talk a little bit about adapting to COVID-19. So as everybody has experienced, this year has been quite crazy. So 2020 has taken a few different turns that nobody really expected, but all we can do is really adapt to changes in the community and changes into what's going on with COVID itself and HIV testing. In Arizona, much like other places, all the testing locations basically stopped providing their services unless it was an emergency or they needed it immediately, or someone was just really in fear of possibly having HIV. So we did encourage our community partners to replace the regular testing practices with the at-home HIV test kits to make it a lot easier for them. Not only did we market ourselves and promote ads on Facebook and Instagram and really just push for that home HIV test kit and pushing for people to stay at home to help flatten the curve with COVID as well. We did a couple things on our site. So originally, when you logged into gettestedaz.org, you would have to complete a survey that included 6 to 7 questions for us to be able to give you that test kit. Talking to our partners at the Arizona Department of Health Services, we were able to remove that survey to make it a lot easier for individuals to request these tests. And not only for the individuals, but also our partner agencies that were distributing these tests as well. We wanted to make it a little bit more streamlined and just a quick process so that they didn't have to sit there for like 3 to 5 minutes answering all these questions. It was simple. You log up to the site, you requested the at-home test kit, and then you simply entered your name, your age, and your address, and we were able to mail it out to you, or the Walgreens card as well. We still included the post-survey afterwards, but just the pre-survey was removed from the site. Again, just to make it easier to navigate for individuals, make it easier for our partner agencies, and just really push for individuals to stay at home for their own safety, for their health, and for everybody else's health as well, and just to really help flatten that COVID curve, and to remind individuals that we did have options still for testing, and to not forget the importance of HIV testing. So we really push for that, and we really push for that message to come through on our ads. As we go on to the next slide, we're going to cover a little bit of the change in numbers from prior to COVID to now during this time. So February through April of 2019, as you can see the breakdown again through Arizona, we have a total of 557 test kits that were requested during that time frame. So it's a pretty good amount. This again is from last year, February through April 2019. Most of it again focused in Phoenix area. Our partner distribution at 136. So it's great that we have those partners that are involved in the community and are able to push for that test and are able to get individuals tested. So as we move on to the next slide, you'll be able to see the difference in numbers from 2019 to 2020. So just alone in that time frame from February to April, we had 866 test requests, which is about 300 more than the year prior. Obviously, it was a great help from our community partners that were pushing for the kit instead of the in-person testing and the marketing that we were doing. But as you can see, individuals really were liking the fact that they could test from home still, and they loved that they had that opportunity to be able to test from home. And we did see a huge spike in our order requests. Normally, on a weekly basis, we would probably ship out around like 40 kits, if that, on a week. And then it quickly shifted to us mailing out close to 100 or over 100 kits every week. So it did make our production a little bit harder since we had to work a little bit faster to produce those kits and be able to mail them out. But overall, there was a huge spike in our orders, and people were really welcoming to the idea of testing from home. And also a lot of individuals who weren't aware of the program got a first glimpse at it, and they had to try it firsthand. And we've gotten a lot of good reviews and good feedback about how they loved it and how they wish they knew this was available sooner, whether it be because they couldn't get to site location or they couldn't have like the money that they thought they needed for testing. So it was a great kind of eye-opening for our community to be able to see that resources are available to them even in times like this. So we can move on to the next slide here. So we're going to talk about what comes in the actual test kit box. And so obviously you're going to get your OraQuick in-home HIV Test Kit. It'll have a wrap around it that was designed by us. It has a little brief description of how the test works. It also includes direct contact phone numbers for myself and Rita's Foundation and an email. So if individuals don't feel comfortable doing the test, they can call us. We'll stay on the phone with them. We'll walk them through it. Or simply if they have a question or they're concerned about certain things, they will call us directly and I will assist them and walk them through the process to make it a little bit easier for them. On the back of that wrap that you can't see in the picture here, but on the back, it explains if you test negative, this is what you can do. We talk about PrEP. We talk about who to call, where to visit to find a provider for PrEP. And then we also have, on the bottom half, it says if you test positive, here's what you need to do. And we have direct contact for us as well. So that individuals who may not have a primary care doctor, they can call us directly and we will connect them to somebody that can help them and make sure that they get into care immediately. And just reminding them of how important it is to find care and that they're not alone in the situation, and they can call us and we can gladly connect them with somebody and help them out and get them into care as soon as we can. We also include a little pamphlet that was designed for PrEP and PEP. So it's going to explain the differences between PrEP and PEP for individuals, and it walks them through kind of the process of getting onto PrEP or how PEP works and who they can call or what resources they have to find a provider that's near them. We also include the Healthy Sexual Handbook, which is an online resource that helps individuals be more comfortable with their sexuality and having conversations about their sexual practices with their primary care doctors. Is a great resource. You go online, you answer a bunch of like little questions, and then it'll kind of make yourself self-discover like what it is that you do sexually, and it's okay to do it, and it just makes you more comfortable with your sexuality and more comfortable with your sexual practices, so that it's easier for you to talk to other individuals about it, and that way you don't get so concerned about judgment or stigma behind it or anything like that. We also include our CAN Community Health teleprep. So CAN Community Health, they can do PrEP virtually, obviously, through teleprep. So we include that information on there. So individuals who want to get on PrEP, they can contact CAN directly and they can set up their appointment and they can do everything virtually for them. And it makes it a lot easier for individuals to get on PrEP, especially during these times where you can't really go out, or if you do go out, a lot of places are not offering you the option to get on PrEP right away, or they have to wait for you to set an appointment, which can take a while. So it's a great option for individuals to have. And then lastly, we also include condoms, and we include a little Get Tested AZ business card. So the business cards, we designed them really to be an easy handout for people. So if you have these cards, you talk to a friend and your friend says, oh, you know, I had a crazy weekend, or this happened and I'm not sure about my sexual health, or I haven't been tested in a while. We make those cards so that individuals can hand them out to their friends and let them know that they have this option, not only for the home test kit, but also in-person testing, but most importantly, that it's all free and that they have somebody they can call directly that can help them get through that process as well. So we can move on to this next slide here. So linkage to care. So with the home test kit, obviously you get your results in person in 20 minutes, so you don't have someone there at all times. Like I said, we do include contact information for Rita's Foundation, so we can link to care. We include the information for PrEP and PEP navigation. We also have the site called HIVAZ.org and the Spanish counterpart, which is VIH-ACET.org. These two sites is basically like your HIV directory for Arizona. So it will list every provider, what they do, how, when you can do it, literally everything you need to know about the provider so that you feel comfortable going into them, so you know that they specialize in certain areas, or that you won't be questioned, or they won't know exactly what you're talking about. It's a super awesome site that you can navigate, and you can pick from categories, whether you want to do PrEP, whether you want to do PEP, transgender care, whatever it might be. It'll list every provider in Arizona on that site, so it makes it easier for individuals to find care. We include the condoms, and we also have a partner of ours, which is called nicepackage.org. So Nice Package, they do condom delivery by mail. So if you sign up for their service, you get condoms mailed to you once a month, and they mail it out in a little brown bag, and it goes directly to your home, no cost to you. And it's an awesome program to have, and they're a great partner, and they obviously provide a lot of condoms. And I know, speaking to them during this COVID pandemic, they said themselves that their orders have spiked a lot. So obviously people are still having sex. So it's great for us to have the at-home HIV test kit, which we can provide as well. And then lastly, we include the Gilead's healthy sexual promotions too. So now when it comes to somebody testing positive, or they have a positive, we obviously work with the Arizona Department of Health Services. They do fund the program for us, so we really appreciate the work that they have put onto us and the trust that they have with us. But with the program itself, out of all the test kits that we've done, the 1,100 initial test kits, we've only had 6 positive results. With those 6 positive results, and working with the Arizona Department of Health Services, we were able to identify that they were linked to care through their EHR service. So all the individuals that have tested positive that we know of through this system have linked to care and have been retained in care, which is awesome to hear. Obviously, this is an anonymous kind of service, so we don't push or follow up as much, but we do have a post survey where individuals can select whether or not they tested positive or negative. And even then, now, if I go back on that survey, we still, I believe, only have had 1 more person test positive in the program, but everybody that has tested positive has mentioned to us, or we've been able to identify they have been linked to care and they have retained in care, which is amazing. We can move on to the next slide here. So measuring acceptability. So this is where I was talking about the post survey and the feedback that we get from individuals. So once you submit the request for your kit, in 2 weeks, you automatically receive an anonymous survey. It's completely optional, so you don't have to take the survey itself, but it's great for us to have that data since we can see that feedback and improve our program in whatever way we can. We also added recently a 21-day follow-up to help us get more responses on that survey. So we do the initial first 2 weeks, and then 21 days after, we send a reminder email. It's kind of like an in case you missed it email to remind individuals that we do have that test, or that survey, I'm sorry, that they can take and provide their feedback to us. All the survey responses have shown that people are very satisfied with the program. They're very satisfied with the site. They think it's easy to navigate and it's easy to go through. And a lot of the responses that we get is that individuals just like the convenience of it. So individuals like the fact that they can do it from home. They don't have to go in person anywhere. Some people feel embarrassed to go in person, or they have anxiety to go into a clinic. So this is great for them. Also, being an oral swab, a lot of people do not like blood, so that helps out as well. But overall, individuals just like the convenience of it. They like the fact that they can do it from home. They like the fact that it gets delivered straight to their home and it's completely free. So they really enjoy that. And like I said prior, we do service a lot of rural communities as well, which don't have that easy of a transportation, or they just don't have a clinic that they know that can do the HIV testing. So the at-home HIV test is obviously their best option, and they are really appreciative of the fact that we can give it to them and it's completely free with no expense. As we move on to this last slide here, this is just some other marketing that we did. So we do have marketing throughout Arizona on billboards. We have posters. We did a lot of bars and nightclubs. We promoted the HIV testing with our newest campaign, which is the only way to flunk this test is not to take it. So you will see posters of that. You see coasters for drinks at bars that have that same design. And also the worst HIV status is unknown, which is a billboard that we have here as well. We really try to promote in areas where we know individuals will see it. So obviously bars and nightclubs is where a lot of younger individuals hang out. We do a lot of social media promotion as well. Social media obviously helps us reach a lot more masses through Arizona instead of just having local bars here. So social media has been a great friend of ours, and we've really used it and taken advantage of how easy it is to promote an ad and how easy it is to boost an ad and get it to individuals all throughout Arizona and not just focus on one area. But yeah, so we have all these ads running currently. We also switch it up every now and then. During the pandemic, obviously we switched our marketing a lot to encourage the staying at home and ordering the test kit and really not leaving your home and watching for your own health and your safety and the health and safety of others as well. So I believe that was this last slide. So let's go to the next one and find out. Yes, so that was the last slide there. As you can see at the bottom, you have my contact information. My name is Juan Lopez again. I'm the Director of Programs with Aunt Rita's Foundation. If you have any questions that we don't answer here, my email is there, so feel free to reach out to me, our phone number as well, and we will answer whatever question you may have or whatever we don't get to on this presentation at the end of it. But thank you guys so much for having us. Thank you, Kay, and thank you, Kayla. And Glenn, unless you have anything else to add, I think we've covered everything.
Thank you, Juan.
Excellent work. Thank you so much. Next, we have Jen Hecht. Jen is involved intimately with building healthy online communities, which is also referred to as BHAWK. BHAWK is a consortium of public health leaders and dating websites working together to deliver at-home testing kits through communities nationally. Their focus is on bridging capacity and data required for public health department reporting purposes. Jen will bring us highlights of this essential work in progress. Welcome, Jen.
Hi, Kay. Thank you so much. Good morning, folks, and good afternoon. I'm so glad to be able to join you and to participate in the webinar that's hosted today by OraSure. And I want to thank Glenn and Juan for an excellent presentation. I've certainly learned a lot from them over the last couple of years. I'm going to talk a little bit about BHOC. So if you can go to the next slide, please. So BHOC works bringing together both public health and dating apps to support HIV and STI prevention. We work with all of the major apps, including Grindr, Tinder, Scruff, Jacked, and Adam for Adam. And we've partnered with many of these apps to ensure that profile options on the apps include options for sexual health information, such as being able to indicate that an individual is on PrEP. We've also partnered with Grindr on testing reminders and on their sexual health resource center. And last year we launched tellyourpartner.org to enable people to anonymously let partners know that they may have been exposed to an STI and encourage them to get tested. Next slide, please. Thank you. BHOC is a consortium, and this is our public health partners across the US. And on the next slide, you can see our dating app partners as well. But today I really am here to talk about our newest service, which is called Take Me Home. And this launched in late March. The service enables people from around the country to order a home test kit for free. And our goal with this program is to address barriers to testing by making participation as easy as possible for both the participant and the health jurisdiction. Recent data from our partnership with Emory's AMIS survey of 10,000 MSM showed that 75% of MSM had used a dating app in the past year, and 22% of MSM on those apps had never tested for HIV. This was even higher among MSM who were under age 25, who live in rural areas, and or who live in the South. And in our formative research, we asked app users which sexual health features they wanted on the apps, and 77% wanted free home HIV testing. So it's a critical place to start, and we've been centering our promotion of this service through the dating apps. Because of our longstanding relationship with the dating apps, we're able to promote through both free ads as well as embedded links. The project depends on partnerships. We are excited to be partnering with both Emory and NASDAD on this project. And NASDAD is definitely playing an essential role due to its relationship with every state and many of the major metro areas. So health departments who want to participate in the project sign up through BHOC and then pay through NASDAD. And NASDAD works with our vendors to maintain contracts as well as accept payments. Health departments do not need to take care of any of the logistics of packing, shipping, ordering kits, or hiring staff. And our partnership with Grindr and several other apps enables us to promote directly to consumers. Here you can see a little bit of what it looks like if you are on the site itself, typically on someone's phone. And the experience for the participant is that they might see an ad, typically on a dating site, and once they click, they would get to our site where they will be prompted to answer 3 basic eligibility questions. If they screen in, they would enter their name and mailing address, and an order would be submitted to our fulfillment vendor. So I wanted to answer a few questions in advance that come up commonly. In terms of the eligibility, we have set it at this point to be individuals who are over the age of 18 and who have not tested in at least a year and are in a participating location. What happens when an individual tests positive? This question comes up a lot. So individuals have multiple different resource options. So they're directed back to our website where they're encouraged to get confirmatory testing. But most importantly, they're given local resources. So each one of our local testing partners compiles resources specific to their area, and that is the information that's available to them. But also, they have the OraSure resources. So both the video that is available that kind of walks folks through the process of taking the test, as well as the 24/7 hotline, which is really an excellent resource for folks who may be having any kind of stress or anxiety or want to know what to do if they test positive. So that kind of adds on to the local resources. And also we want to make sure that information also includes how to get STI testing, condoms, PrEP, and U=U information. And finally, as I noted earlier, there's no need for individual health departments to house the kits themselves or to deal with any of the fulfillment because we have contracted with a company to do that. So in regards to where we are with this project, we launched in late March, and we anticipate rolling out STI testing as well in late July, so in the next 6 to 8 weeks. We started with 4 pilot jurisdictions: Oregon, Tennessee, Montana, and San Francisco. And since that time, we have 5 states and 7 counties that are currently in the process of signing up. And we've had introductory calls with about 50 additional jurisdictions around the country. In our first 11 weeks since we launched in late March, we've had a total of 803 orders, and we've shipped out 945 kits. You'll notice that those numbers are different because we have given jurisdictions the option to decide if they want to be able to send more than 1 kit, if an individual might want to order one for themselves and a partner. So in some cases, you'll see that the number of kits exceeds the number of orders. And in terms of our promotion, as I noted earlier, we have been working with all of the major dating apps We have links added onto most of them, Grindr, Scruff, Jacked, and Atom for Atom. And we've been working very closely with Grindr over the last couple of years in getting this program started. They have been incredibly supportive, and they are offering us a lot of free ads to help get this program off the ground. So while it might be common for them to have ads that have like a 3% click-through rate, what we found with our ads is we're getting on average a 13% click-through rate, which indicates a high level of interest of the app users. To date, we've had over 10,000 visitors to our website, and we're at about 7% or higher in terms of conversion rate, meaning of the people who come to our website, how many go through and order the kit. So that's pretty high compared to what we often see when we look at other kinds of examples of conversions. And just to give you a little bit of a snapshot of who we're reaching, you can see a breakdown here by race. We've had a very wide range of participants by age, gender. We are predominantly reaching men because we're promoting through the dating apps, so I don't think that's a huge surprise. And as I noted, we've really been focusing on folks who have either never tested or haven't tested in at least a year, with the intention of really reaching people who aren't otherwise testing, and with the intention of complementing, not replacing, clinic-based testing. So I want to share some feedback from our participants. Of the folks who've participated in our follow-up survey, and our follow-up survey process is probably quite similar to Glen and Juan's. We've had 100% who have said that they would recommend the service to a friend, and 91% who rated the experience as a 5 out of 5, with the remaining 9% rating it as a 4 out of 5. And I wanted to just share a couple of a little bit of the feedback that we've gotten. This one person, for example, said, "I've never been tested, being sexually active, and with the current pandemic, this means a lot to me. Thank you so much." So what we're really excited to be able to get feedback from participants, but also to recognize that we're reaching people who just otherwise haven't been reached, who feel anxiety about going to a doctor's office, whether because of COVID or just the stress or stigma of getting an HIV test, that we've been able to bring this service to them in their homes. On the next slide, you'll see that we are moving forward with adding some additional features, including STI testing and an administrative portal. So what this means is that 3-site chlamydia and gonorrhea testing will be available, syphilis. Clients will, in that case, have the opportunity to collect their specimen at home, mail it in, have it processed, and then sign into a client portal to get their results. Any positive results will automatically be reported to the health department. And then we're also working on building out an administrative portal. So what this will enable is that participating jurisdictions will be able to download data directly themselves. They'll also be able to tailor eligibility criteria. For example, they may want the amount of time since the last test to be different than 1 year, for example, or they may have other criteria that they want to screen folks in or out. So it will give participating jurisdictions a lot more flexibility. And then our hope is by the end of this year to be able to translate the site into Spanish as well. Just a couple more details on the STI self-collection. So as I noted, we'll have 3-site chlamydia and gonorrhea testing, syphilis and HIV dry blood spot. And we're looking into also the possibility of offering Hep C based on a risk eligibility questionnaire, as well as a PrEP panel. And on the next slide, you'll see kind of what happens when someone tests positive. So essentially there's three options. One is that we give information as to where to access treatment in the local area. But the most likely option that most jurisdictions have indicated that interest in is that the jurisdictions themselves will offer prescriptions through standing orders, and the DIS, often in most jurisdictions, will follow up directly with that participant to be able to make sure they get the treatment that they need. And finally, on the last slide, I just want to make sure you all know, if you're interested and if this is relevant for you, how you sign up. You can go directly to our webpage, bhocpartners.org/home testing. You can contact me directly. and just here to answer any questions that you have. Thank you so much for your time.
Great, thank you very much, Jen. I'm gonna leave this on the screen just for a couple seconds longer because we did have some questions come in around, okay, how do we get connected with BHOC? So we will be recording today's session too. If you weren't able to get down Jen's full contact details, feel free to reach out to myself. I will also be sending the recording out to everyone so you can get those details, or Juan's details as well. So once again, thank you to all of our panelists for the information that you shared today. We're going to go through some of the questions that were submitted now. As I mentioned, I will read out the questions and then have the appropriate panelists provide answers. So one of the first questions we got, and Juan, I think you did talk through this a little bit in your slides, but it may be worth reiterating. For those that tested positive with the in-home test kit, could you go over what the next steps are and how you connect them to care?
Yeah, so individuals that test positive, they have a few options that are included in the package itself. So they can call us directly and we can help them connect to a provider or help them connect to care in whatever way we can. Or they can contact their primary care doctor themselves and connect to care on their own. But we do offer them different options as to who they can call, what websites they can visit, and whatever they feel more comfortable with is the way we like to go through with the process.
Okay, great, thank you. Another question that we got was around the age of the test kit. So someone had submitted a question early on in some of your slides that said they believe that the test kits were only appropriate for people who were 17 years and older.
Yes, so that one on our site, it is 17 and up. I believe I said 16, but it is set for 17 and up. So anybody who is at least 17 years of age and lives in Arizona can request the kit.
Great, thank you. This one is one I'm sure both Jen and Juan you've had to deal with, but we have had a question submitted around the temperature range during shipment. So do you have any best practices that you follow to make sure that the kit isn't compromised during the shipping process?
So basically we keep all our kits in an AC'd location. So during the whole time while we prep them and they wait to be shipped out, they're always in a cool area. When we do the shipping, we do make sure that it's basically 1-day shipping so that it gets to the individual fast. So it's not like a 3 to 4 days where it's waiting in the truck. We do try to get it out to them as fast as we can.
Great, thank you. Jen, did you have anything to add to that?
No, because we're using a fulfillment vendor, so they are taking care of that piece of it.
Okay, great. Jen, this one is for you and the BHOC program. So one of the questions notes that most of the testing initiatives are currently focused on MSM. And the question is around, do you have plans to eventually expand to larger populations, including cisgender heterosexuals, melanated Black individuals, seniors, etc.?
Yeah, thank you. So as I've noted, building healthy online communities really grew out. What it's designed to do is to partner with the dating apps, and we've really focused predominantly on dating apps that are part of the gay community. That said, we certainly are expanding to connect with dating apps like Tinder that are working, that serve everyone. But also, I'm very interested in making sure that this program can work for other populations, and I've had quite a number of conversations with health departments around the country as to other means of promotion. I've talked to groups that are interested in using it for people who inject, for women, for any number of other different groups, and really it's a matter of setting up the promotion appropriately. Another way that we've talked about using the program is specifically integrating it within DIS to make sure that folks who have a recent positive can let their partners know that they might test through this program, or access a free test through the program. So I think there's a lot of possibilities in terms of ensuring that the promotion happens in various populations.
Great, thank you. Juan, I believe this question was asked during your portion of the presentation, but the question was, where did you get funding to pay for the test kits?
Glenn, I'm not sure if you want to cover this since you were initially the first one with the program, but our funding is through the state. Glenn, I don't know if you want to dive a little bit deeper into that.
Yeah, I mean, just quickly, with the lion's share of any funding we receive is from the Arizona Department of Health Services under a contract that we have. It followed from a pilot project that Arizona Department of Health Services administered on their own. And having success with that pilot project, decided to implement this as part of a permanent HIV testing option in Arizona. And we were the lucky recipients as a result of the RFP process. So most of our funding comes from Arizona Department of Health Services. We have had some private funding along the way with smaller grants that allows us to, do some extra marketing or make it available to other target populations in specific ways. But for the most part, it's all our Department of Health.
Great, thank you both. Jen and Juan, I think this is a question that both of you may have something to add to, but the question is, do you use any incentives with the at-home test kits, or are you offering any incentives to participants of the program?
So we do not have any incentives with the home test kit. We basically just offer the service, and we don't push for incentives for anybody to do it itself. We just want to have an easy way for people to get tested. So we just provide the service itself, but we've never looked into like incentives associated with it.
Same with us. We also do not include incentives as part of the process. If I had all the money in the world, I might consider having an incentive as part of the follow-up survey, but unfortunately budgets are limited. So for now, we've got no incentive for either the kit or the survey.
We're on the same page, Jen.
Okay, Juan, again, I think this is one for your program. So you had gone over the number of positives you have found, and I think you kind of answered this question, but just to confirm, do you find there has been an increase in positives since those that aren't comfortable can now do testing in their own home? And I guess, have you seen any jumps since you've seen your testing numbers rise?
From the original test request that we got, there was, I believe, 6 or 7 positives overall. Recently, we've only had 1 more positive, so we haven't seen a spike in positive results. We do see the spike in people ordering the kit, but again, a lot of them might not be reaching back out to us to connect with us for connection to care, since it is pretty anonymous and we try to keep all their information very private, but we haven't seen a huge spike in positive results. So like I said, I believe within the last 6 to 8 months, we've only seen 1 more positive result.
Yeah, and this is, Glenn, let me just add a little bit to that. Because our post-survey is completely voluntary and anonymous, we honestly rely upon our Department of Health partners for them to sort of work with the data sets that they have in terms of persons who have tested positive who are linked into care. So for them to kind of verify that. It's sort of a painstaking process, but I mean, I think it's definitely challenging to know for sure the numbers who have tested positive, and as a result, challenging to know if in fact those persons have linked into care. Having said that, with the smaller data sets that we do have good data on, we've seen that the patients are in fact linking into care. The truth is, most of those individuals do so on their own. They don't necessarily call us and seek referrals, and they simply report back that they have contacted their physician and linked into care. So hopefully some of the fear factor around testing positive has diminished with some of the other marketing campaigns around U=U. Jen, I'm not sure what you're experiencing in that respect.
Yeah, I'll just add, I think, so we're very early in, as noted, we're less than 3 months in, and I'm sending data to each of the participating health departments on a monthly basis. So then on the back end, they would look to see if they've had any positives in their surveillance system that match with the folks participating in the home testing program. So we have had one confirmed positive, but at this point, you know, some of the health departments haven't even had the opportunity to check all of that, and there's certainly a lag. So I would anticipate that number will increase as we send out more data and as they have a chance to kind of look through their surveillance data.
On the note of testing positive, we had a question submitted. Is there a fear of someone hurting themselves if they test positive? Is there any feedback either of you or any of you would like to provide to that comment?
I can start, and I'm sure Juan and Glen may have some things to add. I mean,
Sure.
one thing I will say, I think the OraSure hotline, the 24/7 hotline, is a really excellent tool to be able to offer with the kit. I think it provides a sense that there is someone there available if someone's feeling afraid, whether that's before, during, or after they take the test. But I will say that in terms of the feedback that we get, and we get quite a bit of written feedback either in the direct moment that folks are ordering the test or in the follow-up survey, I have had so many people write in to say, I felt really anxious doing this in a doctor's office or a clinic, and I feel safer and comfortable in the privacy of my home. So I think that sometimes we may have a misconception that people might be more at risk at home as opposed to actually feeling safer.
Yeah, I would just have to add on to that. Like, I agree with everything that you said, and the hotline is a great option to have. And I think also depends on how you market the kit itself and what you include in the kit. So as long, or at least I feel as long as you let individuals know that they have someone they can reach out to immediately and get help or answers, it makes them feel a lot more comfortable. And it does help a lot with their anxiety if they're not at a public place and they can do it at the comfort of their own home.
Thank you both. We have another question for both organizations. How are you confirming negative results in order to get clients onto PrEP?
I can also start with that one.
Thank you.
So I think that we're not using the OraQuick test for that purpose right now. But as we move forward with our STI expansion, we will be offering a PrEP panel. At this point, our intention is not to use it as a mechanism to enroll people on PrEP, but more for clinics that have people already enrolled in PrEP who have either a primary care physician or more likely a clinic that they're connected with that wants to reduce the frequency with which they need to go into the office for that testing. So this would be used to reduce the number of in-office visits they would need, and so that they could get their PrEP panel through the mailed kit.
Yeah, and as for us, confirming negative results, if we do have an individual that wants to get on PrEP and they tested negative with that home kit, we always connect them to either a PrEP navigator or a provider that can help them out. And then that provider will always do a confirmatory test on them. Or we also have our partnership with Albertsons Safeway Pharmacies or Sonoraquist Laboratories, where we can offer them a free confirmatory test as well. And Sonoraquist Labs, it's a lab work test, so we can offer all those for free as well.
Great, thank you. There was one other question that was submitted that I think I can probably address. It was asked if there was any other current HIV test that could be swapped out in place of the OraQuick in-home HIV test. Currently, the OraQuick in-home HIV test is the only true at-home HIV test. So it is the one that we've seen programs work with so far. There were two other questions submitted as well around the cost to sign up, and I believe that's a question targeted at BHOC. And then there is another question around the cost of the home test kit. So Jen has supplied her contact details. Jen, would you say the best way to find out about more information on the setup of the program would be to contact you?
Yeah, I would. I would also say that the minimum participation for our program is in the range of a little bit over 100 kits. And so once you include sort of the full set of service, you get the kit, the shipping, the promotion, all of the data, and all the whole system, that's going to be in the range of $5,000. So you can go up from there. We have groups that are, ordering in the range of, 1,500 kits. We have groups that are ordering 100 kits. But certainly, yes, reach out to me for more details on that as well.
Great, thank you. And if you are interested to find out pricing on the home test kit outside of the program that Jen is running, I have contact information actually that I will pull up now for our teams. OraSure offers a couple different program types that you can purchase the kit. So if you have questions around pricing or have questions around the test kit at all, please feel free to reach out to our sales team. Currently on the screen, I have our public health team. So they are a group of public health professionals who are here to help and answer your questions. Each member of our public health team at OraSure has worked as a leader in the field for HIV and STI prevention and can be a valuable partner to you. So as I said, here's a list of them by state. Please feel free to contact them if you need support or have questions. I also, in a couple of seconds, I will flip to, we have a team list of our clinical support staff as well, who focus on the community health and physician office group. But that concludes today's webinar. We have answered all of the questions. Juan, Glenn, Jen, thank you so much for all the information that you shared today. As I mentioned at the top of the hour, we have recorded today's session and we'll be sending a link out to everyone shortly. We would also, we're going to include a link to a quick survey to see if you found the information discussed today useful. And if you have suggestions for a topic or an organization that you would like us to cover in an upcoming webinar, please be sure to mention that in your survey so we can make sure to keep providing you with useful resources. I'm going to switch the screen now. So here is the roster for our clinical sales team. They're here to answer any questions you may have. As I said, they specialize in community health centers, hospitals, and physician office groups. If you have any questions about today's webinar or about any of the OraQuick products, you can also visit orasure.com/relief to request more information. And our team is prepared to support you in whatever way that we can. As always, I hope that you stay safe and well and healthy. I know that you're striving to fight COVID-19 in your communities and to reach the end of the HIV epidemic. And our team at OraSure believes you are the ones making the difference. So thank you so much for everything you do. Thank you for joining us today, and I will be sending out that recording shortly.